Thank you so much for joining me today. I'm going to talk to you about some of the results that we got from our evaluations with Hunter. So you originally were talking about your concerns for Hunter's academic abilities and that being related to his reading and writing skills as well as his speech production. So this was his reevaluation, so I understand we've had some other evaluations done. So for this time we did the Lingua Systems Articulation Test to evaluate his speech production. So Hunter scored overall on this evaluation below average. So this does indicate that Hunter is exhibiting some speech sound errors. So these errors that he has, they're not really developmentally appropriate for his age. So we're going to want to be working on that. Some of the things that we noticed, first he did demonstrate strengths with his intelligibility. So we do want to continue to improve that, but we understand from what you've said as well that he's understood by both familiar listeners, such as his friends and family, and unfamiliar listeners. So that's good, but we do want to continue to improve that. Some things that we noticed as weaknesses was his productions of R. He often distorted those and substituted them with different sounds, frequently the W sound. And he also omitted and left out some sounds at the ends of his words, like L. That can really have an impact on the intelligibility and his understanding of speech. We did an oral peripheral examination, which means we just looked in his mouth, made sure that his functions were all going well with those motors and articulators, and everything did look normal there. So when we do that examination, we do a part of it that tests his ability to transition between sounds at a quick rate, and that we did notice a little bit of a problem there with his ability to transition. So that's something we'll continue to look at. So I understand that his language is another area of concern, especially with his academics. So we tested him with the clinical evaluation of language fundamentals. And overall, he did reflect an average performance on his receptive and expressive language abilities. So his expressive language is his actual use of that language, whether that be spoken or written. And then his receptive is his understanding of language coming to him. So his comprehension of that. So some strengths were with his expressive language. He demonstrated grammatically correct oral language. So that was good to see. He had a hard time remembering and recalling some of the things that we told him orally. So that could be an area of weakness. When looking at his receptive language, we did notice some strengths in comprehending sentences and following directions. However, on his understanding spoken paragraphs task, this is where we read a paragraph to him. So he was comprehending audible or oral language. And we did notice some weaknesses there. So when we asked him questions to see how he comprehended that language, he did struggle to answer these correctly. So some of those areas were with sequencing, with inferencing, so interpreting that language, making predictions based off of what he's understood. Some of those were not so strong. So we'll continue to look at that as well. Something else we tested with his expressive language is his reading fluency. And so that was something we noticed a problem with when he would read a sentence out loud. A lot of those words he would stumble over or simply read them incorrectly. He would change them, omit certain things, and that can really have an impact on his understanding. Another part of the language that we evaluated was his written language. We used the OWLS 2 written expression subtest, and on this test he did perform below average. So he demonstrated strengths with his social understanding in written language, as well as his organization of his writing, that was good, and his use of detail in his writing. Those were all strengths that he demonstrated. Some of his weaknesses were with his grammar. So a couple of areas that we saw some deficiencies in were his capitalization of words and also just using them in abnormal settings of words, as well as his spelling. His punctuation, he didn't demonstrate a very thorough understanding of those rules. Those were often mixed up. So that's something we'll continue to look at. And also his actual writing, his handwriting. He had some abnormalities with the spacing of letters. Do you have any questions about that speech evaluation and language evaluation?
Do you think those two things are related to each other?
Yes, they certainly can be. So Hunter's ability to produce the correct speech and his ability to understand, it can definitely be hindered if he's not producing those words correctly. That whole learning process it's all encompassing in one, cycle, and he's hearing speech and he's producing it another way, and that can really hinder his understanding all in all.
Okay.
So we also performed a hearing screening. He passed all parts of that, so there was no indication that he was having any problems with his hearing. And his voice and fluency skills were fine. His voice sounded fine with his pitch, and we didn't see any indication of disfluencies or stuttering tendencies. So I'm going to go ahead and give you the diagnosis that we've come up with. So we think that Hunter is displaying a severe speech sound disorder, and that is secondary to childhood apraxia of speech. So both of those are kind of going hand in hand. So childhood apraxia of speech is a motor speech disorder. So it's when those functions, those muscles aren't really making those sounds properly. So it's not that he doesn't know what to do. He does. Hunter probably knows what he's trying to say. It's actually a disconnect between what his brain is telling those muscles to do. So it's not something he doesn't know what he's doing. So another thing with childhood apraxia of speech is there's a really strong correlation between apraxia of speech and deficiencies in spelling, literacy, reading, writing, and language. And those are all things that we're seeing with Hunter during this evaluation. So those are pretty characteristic of apraxia of speech. So they definitely do go hand in hand there. So as I was talking about with the language deficiency, we also think that Hunter has a moderate receptive expressive language disorder. So his performance on those tests that I was referring to earlier, they do indicate that, especially on the writing portion, that he's probably demonstrating this kind of disorder. So that's something that we will continue to look at. So do you have any questions about how we came to this conclusion?
No.
Okay, so I'll go ahead and talk about our goals for therapy. So overall, we want to get Hunter to a place where he's comfortable and excelling in his academics. So we really want to enhance his education in his classroom performance. And I think we'll really be able to do that as we tackle his receptive and expressive language abilities. So our long-term goal is that Hunter will improve his receptive and expressive language skills, like we talked about earlier, in the areas of his reading skills and his writing skills, written language, to promote the enhancement of his academic and classroom performance, like we discussed. So in order to reach that long-term goal, we're going to try to reach several smaller short-term goals. So first, we want to improve his reading fluency, like I discussed earlier, how he was kind of misproducing some of those words, leaving some of them out. That can really influence his understanding. So to improve his reading fluency, we want Hunter to be able to orally read longer, bigger words. He was doing okay with those shorter ones, from a list of words with minimal assistance from the clinician, and no more than 5 errors over 3 consecutive sessions. So we really want to see that limitation of the errors in producing multisyllabic or longer words. We want to improve his spelling. So to do that, Hunter will correctly write a list of words provided orally, so by the clinician, with no assistance and with fewer than 4 errors. So this is kind of how he was tested. We read those words to him, he wrote them down, and that's where we saw that deficiency. Another short-term goal we have is to improve his grammar usage. So Hunter will write sentences describing picture cards using auxiliary verbs like is and are with correct syntactic structure with 80% accuracy. So that's just talking about writing sentences, describing what he sees, and we're really looking for those verbs to be properly used, because that's what we saw a deficiency in on the evaluation. Okay, so if there are no further questions, I think that concludes our conversation, and feel free to contact us with any other questions that you have.
Okay, thank you.